Hello anatomy colleagues, and welcome to station number 17, where we are going to look at some of the specifics regarding the hip joint and what we need to be able to identify. So we are looking at a lateral view where the femur has been very greatly rotated in order for us to be able to see the major components of the hip joint, or the major bony components, excuse me. So you can see the head of the femur pretty clearly here in anatomical position without it being rotated and frankly removed from this region. It would be within this region here, which is the acetabulum. And you can see that there's some ligaments and so forth that are associated with this region that have been removed in order for us to really be able to see that. But that is what we are looking at here, and those are the bony parts of the hip joint. Now this is more in terms of anatomical position and more what you would see, but of course a very deep dissection. So we are down to the very close ligaments as well as the articular capsule around the head of the femur and the acetabulum. And this large ligament right here that is shaded in kind of a teal color is going to be the iliofemoral ligament. This is one of the largest, if not the largest and strongest ligament in the body. It is going to extend from this anterior superior iliac spine, which is kind of the end of the iliac crest right here, all the way down to kind of the space between the two trochanters. So this would be the greater trochanter and the lesser trochanter would be here. So it kind of fills in this whole space right here and is a very robust, very important ligament to this region. You can see a bit of the pubofemoral ligament, which isn't on your list of structures, but I do want to kind of identify it since you can see it here. It will extend from the lateral portion of the pubis, and then its fibers, or its portions of the ligaments will kind of intertwine with those of the iliofemoral as well as the articular capsule. So well, you can see how this whole complex right here is really providing a very important added protection to the articular capsule region. This is an anterior view. This right here is the pubic symphysis, just to kind of get our bearings and better understand where we are. Here, we haven't actually seen this view here, so I'm going to point it out while I have the chance. This is where the obturator foramen would be, but recall that I told you that during life it would be completely occluded with this obturator membrane, which will allow for muscle attachments in this region. So this would be that obturator membrane that is filling in the obturator foramen. All right, so that is what you need to be able to identify for the hip joint. Obviously, there's a lot more conceptual that I need you to know for this region, but if you can get this iliofemoral ligament down, you should be in a good place. All right, thank you for your time and attention here, and I will see you at the next station where we will talk the knee joint.